annually. And if they're sexually active and have had multiple partners, they might want to test in between partners and wait 3 months after activity to do a retest to confirm if they're negative or not during that 3 month period of time. Because with HIV, it takes about 3 months for the antibodies to develop in your system for the virus to show up. So you could actually test, but if you test too soon, the antibodies won't show up yet in your system, and it won't trigger the test to show if you've got an actual positive. So you want to give your body 3 months after the last sexual contact for the antibodies to develop in the system to show if you've actually contracted the HIV virus.
Okay.
If you test too soon, you'll get a false negative. You could actually be positive, but your test the virus hasn't been in the system long enough to show that you actually contracted it.
Okay. Do a lot of students come to get tested? Or do you find that they're afraid?
Some students are afraid, but we've had students testing, and a couple of weeks ago we tested at the education building. We had 99 students test. We had turned people away. So I think a lot of students now feel comfortable with testing. I think it's gotten a lot easier. The stigma is not there. We've been testing here at Central State for about 10 years now, and we've always had participation by the students. I think they know enough to know that HIV is out there, and they want to be tested for it. So it's gotten better. We have a lot of students show up, and I'm really happy for that. But there are a portion of students who don't seek out medical care for anything, and if it's not broke, don't fix it, and they don't come and test. They tend to not come to student health services. They may be off campus a lot or travel a lot off campus, and they're in denial. And there's still a proportion of students that are like that.
And what would you tell students like that to do?
Well, if they're sexually active, I would recommend that they get tested and not be scared. And it's better to know than to not know, because the earlier you can get treatment, if you do catch HIV, the healthier you'll be for the rest of your entire life. If you don't get tested early and detect early, the longer you wait where that the virus has not been treated in your body, the more damage that will occur to the immune system. And once the immune system is damaged to a certain extent, your body will no longer just have HIV, it will have what's called acquired immunodeficiency syndrome, or AIDS. And that means the immune system's been so damaged that you can't fight off infection anymore. Your body can be damaged from other diseases that would normally not cause you to get sick, because your immune system would be strong and it would fight them off. But when you have AIDS, your immune system can't fight off other infections. Like a cold could turn into pneumonia, exposure to TB. Bacteria you could get TB more easily. Other diseases that your immune system would normally fight off and you wouldn't get sick from, or you get sick and recuperate quickly, your body couldn't fight off and you could get sick. And they're called opportunistic infections, other infections that would hurt you, would harm you, and cause possible death if you don't treat the HIV early. If they've been sexually active for several years before they come on campus, they should get tested before they become active on campus. We've got students that might come here that have never had sex, but we've got students that might have had sex since they were 13, 14, or younger. And if they've never been tested, it's time to get tested. If you're old enough to take the responsibility of having sex, you're old enough to get tested. If you're scared of testing, then you're not really taking responsibility for your sexuality. Maybe if you can't face that reality, maybe you shouldn't be having sex. If you can't deal with all that comes with sex, the pregnancies, the possible disease, the relationships, the psychological impact, the time that you're going to spend involved with sexual activity that could distract you from school, maybe you're not ready. And it's okay for them to stop, but a lot of people get distracted, and we don't want them to be distracted, and we certainly don't want anything sexual that can be avoided to get in the way of their completing school. And students that are positive, that I've diagnosed at college campuses, I encourage them, the first thing to remember is you can get treatment, but stay in school, finish school. You're going to need to have a job. Just because you get HIV doesn't mean you stop your life. It means you get treatment, you take care of your health, and you don't spread the disease. You have to be responsible. And we've got to teach college students to be responsible about their sexuality, to take responsibility for their sexuality, and not have excuses. Because sexuality still has a stigma in our culture. We see it on TV, it's on the media, it's everywhere. But we don't really talk about it in a healthy way that we can prepare for what comes from sex.
Are students being educated on HIV and AIDS while being tested?
Yes, we do give as much education as we can. When we do large testing events, it's somewhat difficult to give the education. Often we like to do classes and education maybe the evening before, like in the dormitory, and then offer testing at some other time. It's easier, but usually we like to spend about 15 minutes, at least 5 to 15 minutes educating students. Some students know how you get HIV, some students don't, and it's pretty clear cut. Would you like me to share some of that with you about how you get it? Well, you can get HIV from unprotected vaginal, anal, oral sex, sharing any kind of a needle that could have someone's blood product on it, through tattooing and body piercing. And if the ink has been shared with someone else, you can get it through the ink. It could be contaminated. A mother can spread HIV, a baby can contract HIV from its mother in utero, but that's only about 22% if the mother doesn't get treatment, and then less than 1% if the mother does get treatment early on in the pregnancy. So we can avoid having mother-to-child transmission. The easiest route of transmission sexually is receiving anal sex. And that would be in the butt, of course. I'm just going to say it like that. So college students, some may not know what that is, and then vaginal sex, and then oral sex. And I know people don't want to talk about that, but I don't think our young people know. And right now we have a tremendous epidemic among young African-American males who have sex with males. And they're not getting the education when they're young, and they're dealing with issues of stigma and shame. No one's educating and talking to them, and sometimes they've experienced bullying, or they don't want to come out about it, and so they don't educate themselves. And that's where we're seeing our numbers right now, are young African American males. It's important. I think it's before you get here. By the time people get to college, some of them have been sexually active for 3 or 4 or 5 years and have already had some STDs or a pregnancy.
Is the rate of HIV/AIDS infection declining or progressing?
Well, in certain populations, it is increasing. It's flat in other populations, but in the African American population, we've seen an increase, particularly among young men of color who are with men. And the CDC, or Center for Disease Control and Prevention, has just released new statistics on that, and they are calling for more intervention and education among that population. We have to reach young men, and if we just shut down to the discussions about the topics that concern them and their sexuality and their identity, and they feel rejected, they're not going to come out, and they're not going to protect themselves. They won't get the intervention that they need. Education, and maybe having support groups or a student organization that allows young men or women, a GLBT type organization on campus.
What is GLBT?
Gay, lesbian, bi, and transsexual. Now, I'm not saying I'm not making a judgment. I just know that other HBCUs have these types of organizations, so that people can feel safe if they want to come out. People can feel safe somewhere talking about their experiences, and people don't feel intimidated that they're going to be bullied or called names. And then there's going to be a proportion of people that will never come out. I mean, you don't have to. I just think that you need to be safe. And if they need if if young men need an organization specific to them or young women, we need to find a way for them to be safe, and feel comfortable getting this information. The more discussion you have on a topic, the more people can process it and understand it. I think people fear it because they don't understand it, and they fear it because of the stigma. So I think, yes, of course, student organizations on campus. And, some of your population is within these student organizations, but they will not come out because they don't want to be discriminated against. And just face it, if you are a young man who partners with men, and you want to go on and get your master's degree, maybe get a PhD, and you're African American, the last thing you want is for someone to hold something else against you. You want to be able to succeed. So one might be able to understand why they would not want to disclose that to their peers or to someone at the university, because they don't want someone to hold it against them. They don't want anything to interfere with their ability to have an income at some point and be employed. So there are a lot of things that go along with the non-disclosure, and it's really no one's business, but I think educating everybody equally on how to stay safe should do the trick, and making people feel comfortable. They don't have to identify or not identify. Are they being safe? And what is a healthy relationship? And how to stay healthy. If everyone gets that information, I think we could reduce a lot of the sexually transmitted diseases on campus that occur. Just that it's important for all of us to have the discussion, and even as a student, you can spread the word to your friends, relatives, your peers, anyone you're in an organization with. Put on an event, talk about it, and condoms are safe and they're effective and they're less expensive than treating a disease. So we have to get over our phobia of dealing with these topics and talking about it, because people, I think, are still uncomfortable. They feel that if you talk about it, you're encouraging sexual activity in a way, and I think if people learn, they will know what's best for them and take some precaution.